Good morning, everybody. I'm Tim Sheehan. I'm the Executive Director of the Alzheimer's Association New Mexico chapter, and it is my pleasure to introduce Buffie Saavedra, who is the Community and Member Director for Molina Healthcare, New Mexico. Her subject is navigating long-term care in New Mexico. And also just want to remind everybody that Buffie and her team will be available in the exhibit hall. So please stop by the virtual exhibit hall throughout the day and say hi to them virtually. So with that, take it away, Buffie.
Thank you, Tim, and good morning, everyone. Happy kind of partly cloudy to mostly cloudy Saturday morning here in Albuquerque. So I know we have folks from all over joining us, which is one of the really positive things about virtual collaboration, is that we're able to actually have maybe people attend that wouldn't have been able to attend otherwise. So I welcome everyone this morning. And it does feel a little more like November today, I think, than it has in a while. So I'm Buffie Saavedra. I work at Molina Healthcare, but today I'm going to be presenting to you some information just based on many years that I've had in the advocacy and healthcare world, and in particular, the world of long-term care services and supports and helping family members, caregivers, providers and others kind of navigate the system. And when I say the system, I say that just kind of more in an overarching way. So I hope you find this presentation useful and helpful, and it will be posted by the team at the Alzheimer's Association for you to have and utilize yourself if you find it useful. So let's start with just talking about long-term care. And so it's like, what is that? And what does it mean? And I think we all have different ideas and understanding of it. And especially folks maybe that may be new to caring for a loved one or being an individual that might be considering the need. So long-term care and the need of such can come on in life at any age. I think that's a reality that's a little hard to swallow, but we could have different things that happen in our lives or in the lives of our loved ones that may, then make us consider what we need as far as long-term care services and supports. Long-term care is not just nursing home care. So I think that is a new concept for some people. And I think really back in the day, that was the only type of long-term care. And then long-term care isn't paid for by standard health insurance or by Medicare. And that is a shocker, I think, to most everyone I know, and folks I meet that are new to Medicare in particular. And even when my dad was afflicted with Alzheimer's, my family, I think most people think that there is something somewhere that pays for long-term care from just our standard health coverage and or Medicare. So let's dig into these three initial pieces first. So the first one was talking about long-term care could be needed at any age. And I think this is something that I'm encouraging folks attending this session, and I try to even encourage myself to remember, any time in life and through our lives, and this pandemic is a great example, things change, and the fluidity and the ability to roll with that and flow with that really is challenging a lot of times. And so some different reasons we may need long-term care have to do with age. So we could age and grow to be older, and maybe some of our abilities may not be the same, and we may need some support. It could be because of disease like Alzheimer's, and an affliction is so heavy and can change and evolve so drastically over time that can be another reason. And sometimes it's the combination. We could have an accident, and that's another thing that could change our lives forever. I had a really good friend when I was working for Aging Long-Term Services way back in the early 2000s who was an accountant, and she was in a car accident and got a traumatic brain injury, and her life changed forever forward. And she actually received long-term care services and supports at an assisted living facility. And she was, about my age, in her 50s. And so it's just, back then she was younger, she was in her 30s. So those are things kind of to digest and think about, as scary as they are, but it's good to think about them. And then we can have a loss or lack of our abilities because of all of the reasons identified. And then there's other reasons. But it's just good to remember at any age. I think a lot of times people think, well, long-term care is for the elderly or whatnot. And it's just good for us to know it can happen at any age. Long-term care settings can differ. So long-term care services and supports can be provided in a long-term care facility. They can also be provided in the community, i.e. at home or place of residence, and an assisted living facility could be considered that community setting as well. I think, way back in the day, especially in New Mexico, because we've done a great job because of all of our leadership that we have in our state currently and in prior decades even, have focused on giving opportunity for community-based benefits. And we've had services in place to provide long-term services and supports in the community, since the 80s. So it's really amazing what New Mexico has done. But there are those two opportunities. And then the third piece we had in the opening slide was, how is it paid for? And I think it is shocking that it's not covered by regular healthcare insurance or by Medicare. So one of the key ways that folks pay for it could be just by buying a long-term care insurance policy. And we'll talk a little bit more about that, not in great depth. I've given some links to some resources for the pros to get more information from, but that is one option that came about probably about 20 years ago that wasn't in place before. So that is actually an insurance policy that someone can buy. And we'll talk a little bit about that in the next slides. The next is self-pay, and so, or family supporting the payment of a loved one's need. And because of the cost of long-term care services and supports, depending on one's need, any savings and other assets and resources that maybe would be liquidated and utilized can go extremely quick. It is amazing how much it costs to provide long-term care services and supports, and whether it's in a community setting or in a facility. And then the third key component that could be a form of payment is Medicaid. And Medicaid is state funded with support of federal dollars, and the federal funding differs by state. And it is the payer of last resort, but it is a payer that is actually pays for quite a bit of long-term care services and supports in New Mexico and in many states. So let's dig in a little bit. So there's so many considerations that we need to think about to know what we might and how we might plan for our long-term care needs for either ourselves or our loved ones. One is age. I keep bringing that up, but I'll show you why. One is our health status, financial considerations. Do we have money and savings? Do we have, other things in place? Medical history, as well as our heredity. What does it mean for us, and what might we anticipate or plan for? And then knowing that the future, as I mentioned earlier, isn't always a long time away. Future is right after this session. The future is, the next hour. The future is in tomorrow, a month, a year, or years away. And so it's thinking about blocks of time differently, I think, can help us plan. So we're going to first talk about long-term care insurance. So there are resources out there. I provided 2 links here for what I thought were some really good resources available, but there's others. And so, we have the great opportunity nowadays to have search engines and look things up. But one of the ones that I found to have a lot of information, and it was pretty robust, is the American Association of Long-Term Care Insurance. And so that had a lot of great information when I navigated the site, and have navigated it before. And I think it's a great opportunity to go to and check it out. And then, of course, AARP, always a long-standing organization that provides great information and supports to individuals as far as resources. That link is provided for you here, and it gives you an opportunity to do some comparisons as well. Neither directly sell long-term care insurance, so I find that extremely useful also. So I wanted to give you an example of rates. And so some of the questions that arise are, does long-term care insurance cost the same for everyone at any age? And the answer is no. And even across that, each insurance company charges something different, and they set their own rates. And rate setting is a robust and very complicated process. And so there are so many other dependent factors, including age and health status. So I provided some examples, and this was from the American Association of Long-Term Care Insurance off of their website. If you go in there, you'll see some of these examples, but you can see how it varies across companies. And they didn't provide company names here, but we have some average and some low and some high costs. And as we age, if we buy the insurance, most of them actually, the premiums will increase as we age. And not all of them cover every illness we might be afflicted with, and not all of them pay for, and most of them don't pay for all of the cost of the care. And many cover just institutional care, nursing home care, while some only cover care at home, and then some are a combination. So there are so many factors and things to think about, and then also the ability financially to be able to pay for that coverage over time, not just when we're maybe middle-aged or younger and a lower premium might be in place, but understanding that there's a time frame, and usually if you don't need it, you don't get the money back. So lots of things to look at if anyone's looking at buying that insurance or considering it. There's a lot of factors, and it's a good thing to research it. So self-pay. Some people have savings. Some folks, their children can help support, or other family can help support the cost of care. Some folks might sell some assets that they might have. They might cash in some resources and other types of opportunities. My grandfather, on my father's side, needed long-term care toward the end of his life. And interestingly enough, he grew up only going through, I think it was 6th grade. He had his own business. He was a shoe cobbler. He had Superior Shoes here in Albuquerque off of Central and off of 6th and 2nd Street areas, 2 different places over time. His last one was on 6th off of Central. And he saved his money. He was a saver. And so when he had the need, he was able to pay for it from his savings, which I've always found extremely amazing, being that's what his line of business was, and that was his education. So it's not impossible, I guess is what I'm saying. And but it's challenging. And if you have other things to pay for, children and challenges in life and everything else, we may not have savings or resources that we can utilize. But that's one of the ways it gets paid for. And then there's Medicaid, which in New Mexico, we in our leadership, we as citizens, our leadership, do a great job, funding what we need here in the state and supporting opportunities so that we can bring in more federal money to support the needs that we have in our state. With our high poverty levels in our state and our high disease states, we do have a lot of folks that receive support through the Medicaid system, close to 800,000, I think, if not 9, now that COVID has hit. And for folks that are part of that opportunity, there are long-term services and supports available for those who meet the qualification of need based on their assessments that they receive. And we'll talk a little bit about that. So we do lead the country in community-based focus. We're one of the top states that have focus on providing services in the community setting, meaning usually at home, and with other supports in the community to provide a full spectrum of care. But there's also folks that need it in the facility. So how do I get started would be a big question. So you're going to see the name of the Aging Long-Term Services Department, and in particular, the Aging and Disability Resource Center, in a few slides in this presentation. Had the pleasure of working there over my lifetime on and off, amazing opportunity. And the resource centers are national and ours in New Mexico is within this department. The number is here in the deck, and folks will have this deck, to access, but you can also write it down. And this team actually is a great team that can help families navigate access to long-term services and supports, as well as other services and programs here in New Mexico. So getting started is a kind of a tiered, a tiered process. And so one of the things to know is that the long-term services and supports that are available through Medicaid, we did talk about nursing home care for custodial care needs. Custodial care means someone needs pretty much 24/7 care, assisted living for intermediate care and support, and then home and community-based services for those that might be able to reside at home. And those services that are included in that are adult daycare, personal care, environmental modifications, respite, full Medicaid for physical, behavioral health, includes dental and vision and the transportation and so much more. And so all of these are all robust systems and provisions for long-term services and supports. And depending on a person's need and on, if they need 24/7, if they don't have family supports, if they may not have a safe or environment that they live in, or a home maybe where they don't have one level and things like that, all of that comes into play for what choice somebody may utilize within Medicaid, and even for self-pay and for private long-term care insurance decisions. So if somebody is already on full Medicaid in New Mexico, this is a rather easy process versus getting into the system brand new. So Centennial Care is the name of our full Medicaid program in New Mexico. I'm sure most, if not all of you, have heard of that, but if not, that's what it's called. It's from beginning of life to end of life. So it's all ages and all types of Medicaid, all bucketed into a really wonderful managed care program called Centennial Care. And so if somebody is already in full Medicaid, i.e. Centennial Care, they can access long-term services and supports by reaching out to their managed care organization. And if someone doesn't know who their organization is, they can surely call or access through the state Medicaid Human Services Department. But most folks would have an ID card that would let them know which entity that is for their full Medicaid. And in reaching out to that entity, you would want to inquire about getting an assessment. So usually a health risk assessment happens annually, and then it would trigger what's called a comprehensive needs assessment. And that CNA, comprehensive needs assessment, actually helps folks know that are working on the managed care side what an individual needs. Have they had a change in status, and are they going to need personal care? Are they able to stay at home safely? Might they be looking at an assisted living? Maybe they need 24/7 custodial care. Maybe it's that drastic of a need. All of that gets assessed. And then there's also other opportunities for resources and other things that care coordination team would identify. So if somebody is not yet on full Medicaid, i.e. Centennial Care, there are things that they need to do, or you would do as their, if you're their representative or their caregiver and you're supporting them, family member, whatnot, to try to access care and services through Medicaid. So in order to register for the home and community-based side of it, it's called a home and community-based waiver. And that waiver allows someone to stay in the community, either in a home setting or assisted living setting. And registration is, again, through the Aging and Long-Term Services Department. So you'll see this phone number here. They manage that registry, and they work with Human Services to then get information together. And there'll be communication that goes back and forth by both entities to the individual or their family that, for the application. There is an income eligibility that's at this time, it's changed every year in the first quarter of the year by the federal government, but it's $2,349 a month or less, with assets and resources of $2,000 or less. And there's a disregard for one home and one vehicle. So when we talk about assets, there's things that count against people above one home and one vehicle. A lot of times in New Mexico, my experience has been that people are what I call they're land poor. So they might own property in addition to maybe their home and or just own property, and that's considered an asset if the worth of it is more than $2,000. And so they have to look for how maybe possibly to get that into a trust or something so that they're able to qualify for full Medicaid. So that's been a big challenge in New Mexico in my career of advocacy and trying to help families, figure out what to do, because here's this plot of land, they don't want to get rid of it, but it's under that person's, their mom or dad's name, and it counts against them as an asset. So it can be a big conundrum that we don't even think about. So one of the other opportunities, and we talked about this in prior slides, is the institutional Medicaid side of Medicaid. So this is the facility side, and you'll see the qualifying income and asset and resource is the same. And so in New Mexico, the consideration also for somebody's abilities to hit a nursing facility level of care is the same, either what someone wants to and can stay in the community setting or be in a nursing home. I know this is a lot of information and it can make your head spin, but I think these are some good baseline pieces to know about. There is, for either consideration, especially for nursing home, there is a whole process that happens if someone is married, so that the spouse isn't left with nothing. And you'll see some numbers up here. For married applicants, there's special income and resource rules, and it's up to $119,220. It's an odd number of the couple's resources that can be protected for the non-institutionalized spouse. And so when we talk about the 2,000, you can see that this is the part though that's protected if someone is married, that's a consideration for the spouse that's not needing the long-term services and supports in a facility. So there is a patient liability even on Medicaid for nursing home care, and it's called a medical care credit, and also for assisted living if someone goes into that choice or opportunity versus being at home. And so a person's medical care credit, there's a percentage or an amount of a person's income that will be going toward the medical care credit, with the exception of $74 to use every month for personal needs. I think for some people that's a shock, but state Medicaid, of course, comes from, state general fund, and then from supplemental dollars from the feds, and there's rules around all of that. And so the medical care credit is a very true part of this process. So that's why if someone is married, you'll see that there is protection up to an amount for the spouse that's not being institutionalized. There's benefit and coverage information on this slide. And so you'll see some of that information. If someone's in a nursing home, all of the things that are covered are all encompassed at the facility. That's all part of custodial care in addition to the regular care that someone would need for physical or behavioral supports as well. How does somebody apply for this? So this is not through the Aging and Long-Term Services Department. There is a web link here, and within the web link, you'll find phone numbers as well, but it's through the Income Support Division of our Human Services Department. And if somebody's already in a nursing home, usually the care or case managers will help the family or the individual or the advocate work on this for a consumer if maybe they're where they can't self-pay anymore, or something else has happened. Okay. A lot of information. So there's one other option that we don't talk a lot about in New Mexico, I think in all circles, because it's not available statewide, and it's called the PACE program. So PACE is called, it's the Program for All-Inclusive Care. It is been around a long time across the country, but it depends on a very strong infrastructure of resources, provider systems, and all sorts of different mechanisms to survive and be able to provide the all-inclusive care to individuals. So it is in Bernalillo County, in the Albuquerque area presently. I am unsure if it's gotten itself down to Doña Ana, but there is a link on the next page. You can go and look and call and ask questions and understand who the provider entity is for our PACE program here in New Mexico. PACE is really different from the nursing home or the community based benefit in that it becomes the everything for the person, meaning it becomes their Medicare, their Medicaid, their prescription benefit, the long-term services and supports piece. It's everything. So everything falls under that umbrella, and someone has to be 55 or older to be part of it. There is a wait list. There's slots for PACE, but it is a very robust opportunity, but it's not available everywhere. You can see here that I provided a phone number as well as the link for the entity that provides PACE here in New Mexico, and it's called Innovage of Greater New Mexico. And I think you'll find great information there, and you can call and ask questions and see if and where else they might be. PACE is in other states, so if you're here visiting us and you're attending this conference and you've found this information useful, when you go to this link, you'll be able to pull your state up and find out if and what is available there for yourself or your loved one, just so you have that knowledge and information and can do that research. If you are attending from another state, or maybe you help family in another state, whatever that might look like, the Medicaid home and community-based waiver opportunity looks different in each state, and the levels of care and the activities of daily living or independent activities of daily living that one would not be able to perform to be able to qualify for either home and community-based or nursing home care or PACE in New Mexico is 2 or more. In other states, it's different. It might be lower for community and higher for nursing home. And you really want to reach out to your state human services or aging departments to find that out if you're from another state or thinking of moving to another state. The other thing to know is your Medicaid does not go with you like your Medicare does. So good things to remember. So this is a lot of info in the deck, a lot of information I've spoken about. There's 3 key considerations I think we should all be aware of for ourselves, for our loved ones, whomever we're here for, interested in finding information about. They are need, they are financial, and they are environmental. Can't say that word today. So need, financial, and environmental. So what does that mean? Well, the need. So what is somebody's need right now? Maybe it's nothing at all, and we're interested in this to see what we might be expecting to happen. So I know when my dad was in his early stages of Alzheimer's, it's dementia, and before it was even identified to be Alzheimer's, his need wasn't really high. Sometimes there were some reminders or just an understanding that we couldn't get something in his mind, or remember to do something. It wasn't as drastic, and then that need got greater as his disease furthered, all the way until he actually had to be institutionalized. And so the need will change. It's a continuum. Some people may already be at that end phase. They haven't, that's already where they're at. Others may be just in the beginning and thinking about it. And many of us that maybe we consider ourselves healthy, as best as we can be now, this is still something to think about, for long-term, what is that going to look like if we're going to need something. Financial. It's never too late or too early to look at how financially we might be able to get access long-term services and supports either for ourselves or our family members. And then environmental. And what does that mean? So if you live alone, I live alone, I'm empty nested. If I were to end up having a need, I wouldn't have a natural support here with me that lives with me to be able to provide maybe a smaller need or even a greater need in the future. So with that, something drastically changed with my need level, and my environmental might mean that I might have to be somewhere else or have the ability to bring care in. So that's kind of an example. Okay. So now I think we're ready to see if anyone has any questions or comments or anything I can try to answer and we can talk about together. And then if I can't answer it, I've got my pen and my notepad here. I'll take down the questions and try to get, information back to you all. So Tim, do we have anything?
Absolutely. Buffy, first of all, thank you very much for all the great information today. And the one question that kept popping up was, can we have a copy of the slides? And if you go to your Files tab on our main page there, it actually says files, and we have put the slides right in there so anyone can have access to them with all the good information. Let's see what else. Someone asked if, can you show the links again for long-term care?
Yes.
Okay, is that possible?
Let me go backwards. Let's see here. Let me get that for us. Hold on one second. There we go. Okay.
And
So
again, while
what-
people, I was going to say the links for long-term care. So they're,
Oh, for the insurance, I'll bet you.
yeah.
Here we go.
And then also, if anyone else has any questions, please put them in the chat box right now, and we will be glad to answer them.
These links are great links. And I know following my presentation today, I'm going to put a little shout out for my good friend Gary Williams at AARP. They are presenting, or Gary's presenting today, and information from AARP is endless. And so in addition to the association, I think, when you go into AARP's website, not only for long-term care comparison, but there's so many resources there that you'll be able to find as a caregiver, as an individual, as a family member, whatever you're here, whatever mix, make, and model you are, use that resource. And if you've not attended their presentation, I would really encourage it. And no offense to anybody that's doing another one at the same time, but they are a great organization, and there's some great information.
And that session is coming up under the
Yes,
11
after this
o'clock.
one.
Exactly.
Yeah, little plug.
There you go. He had a great turnout yesterday for his session. So that was
Good.
great.
Gary's easy to listen to. He's very, very smart, and we worked together for decades, even when we were both at the state. So,
Any other questions out there? I don't see anything else in the chat right now.
good. I either stumped everyone or it was a good information.
Well, lots of good information, but I think you got some good information for people to follow up on in the slide deck.
Yes.
So that'll be
Excellent.
great.
And anybody and
got a
everybody,
couple
you're
chats.
welcome to use this stack. This isn't branded in any way. You can remove my name from the front, and you're welcome to use it to educate or provide information. So please plagiarize.
Buffy, we do have a couple of them that are saying thank you
Okay.
very much. And then another one says, in calculating qualifications for Medicaid / Medicare, is it the patient themselves, or would it be the spouse's income and resources included?
It's a really good question. So Medicare, there's not a qualification for financially. So let's start there. Medicare is, we are able to get Medicare, and if we're not of lower income levels, we pay a premium for Medicare upon age 65, or because of disability and applying through Social Security disability, SSDI, okay? And Medicare is the health side of it, of when we're able to access it. We can waive our Medicare if we're still working at age 65 and have health coverage, like my mom, who's 82, and she has her Part A, but waived her B and D because her employer provides her insurance. So that's separate, and that's the part that does not pay for custodial care, okay? So for Medicaid, at any age, it is the individual's, so it depends on what you're accessing. So there's an individual income, but when you're looking at custodial care for long-term care, or any other form of Medicaid that has an asset and resource limitation, there's an amount that they'll separate out for the spouse, and then will be considered the remainder as the asset or resource that might have to be put into a trust or otherwise. So those are things to remember, and it gets really sticky. There are some really good folks also presenting today from legal services. I would say if you live in the Bernalillo County area, and I think they do now the surrounding of I think it's Torrance, Valencia, Sandoval. I might be slinging this too far, but Senior Citizens Law Office is incredible and can help you with that. And then the lawyer referral for the elderly is equally incredible, and they will find that assistance for you. And those are usually no cost or sliding fee scale supports, because it depends on the category of Medicaid, but usually it's a household income can effectuate and assets and resources. So know that. The only category of Medicaid, interestingly enough, and this isn't a long-term care category, that doesn't have an asset or resource requirement is Medicaid expansion that just came about because of the Affordable Care Act. And in New Mexico, we did expand Medicaid. So it's for adults age 19 to 64 who are not yet on Medicare. And so that's the only one in the country that doesn't have an asset or resource requirement, just income, and it's individual. I found that fascinating. Any other questions, Tim? I hope that was helpful. Okay.
We don't have any other questions at this time, but again, Buffy, thank you very much. And I also encourage everybody to go into the exhibit hall, visit with Molina and all of our other sponsors in there, and continue on today with our sessions. And I will tell you at 3 o'clock, we're going to have an exciting session with Dr. Rebecca Edelmeyer, who's with our scientific research department of the Alzheimer's office. So please join us the whole day.
Excellent.
Thank you very much.
Yeah, thank you all. Have a wonderful day and enjoy the conference. Thank you for attending.
All right. Thank you.
Thank you.